Hello, we have a patient here who is suffering from a stress fracture with a hairline crack in the radius of the left arm. In this x-ray, the bones show up white because the calcium in them, and it absorbs the most radiation from the x-ray, making them pure white. Then, the fat and other surrounding tissues are less dense and appear gray because they absorbed less radiation than the bones. And finally, the gases in the water that surround the bones are the least dense and appear black, which means they absorb the least amount of radiation.
The bone that appears at the top with the stress fracture is called the radius. The bone below the radius is the ulna. The large bone that appears on the right side of the x-ray is the humerus, and the joint connecting the ulna and the humerus is called the hinge joint.
In a normal forearm x-ray, you would not see a line in any of the bones, which is an indicator of a fracture or a break. However, in this x-ray, there is a non-displaced stress fracture in the radius. When there is a fracture, the line will appear black because there is nothing there connecting the bone together. Therefore, the radiation will not be absorbed because of the hairline crack.
So based on the research we did about the patient, we found that the most effective treatment plan would be rest, because a patient should take a break from the activity that caused the stress fracture for 6 to 8 weeks. Most fractured bones will require to be set back into place into their normal position. This would be accomplished by repositioning the bone through closed reduction, which does not require surgery. Then a splint would be placed on the forearm for the first few days to allow for swelling. After the swelling goes down, a cast is applied and changed every 2 to 3 weeks to adjust for the size for when the swelling goes down. Then the doctor will monitor the healing through multiple x-rays, and after 6 weeks the cast will be then taken off and physical therapy is usually recommended.